My name is Georgia Roark. I am a 4th semester nursing student. Today is March 21st, 2019, and it is 11:05 in the morning, and today I'm going to be doing an enema. So beforehand, I want to make sure I have an order for the enema. I also want to make sure I know how my patient's going to be used in the bathroom, so I have a bedpan here ready to go, and then I'm also going to be assessing the abdomen before the enema. So let's get started. Hi, Mr. Jones. My name is Georgia. I'm going to be your nursing student today. How are you doing? Good. Can you tell me your name and date of birth? Perfect. And do you have any allergies, Mr. Jones? No? Okay. We're going to be doing an enema, okay? I'm going to go ahead and raise the bed to my waist and lay my patient down. Okay. So before I do anything else, I'm going to go ahead and get my enema kit ready. So I have all my supplies here beforehand. I've got my towel and my bath blanket, my disposable chuck, my enema kit, my normal saline solution, and of course my bedpan for when it's time to go. I'm going to go ahead and get my enema kit out ready. And you'll fill it as full as the doctor's order says. So typically that's 500 to 1,000 milliliters. Perfect. Okay. I'm also going to go ahead and prime it. So it's unclamping it, making sure I get all the air out. Perfect. Go ahead and clamp it back. Okay. So now my bag is ready to go. So now I'm going to go ahead and I'm going to ask my patient when his last bowel movement was and what color it was, the consistency, the amount, and then we're going to go ahead and assess the abdomen. So first I'm going to inspect it. I'm going to be looking to see if the abdomen is full or distended, if it looks like there's any swelling or anything. And then I'm going to go ahead and auscultate in each quadrant, listening for bowel sounds. Perfect. So it sounds normal active. There's a bit of distension, and I'm going to go ahead and palpate just a little bit to feel if it's hard or soft or, firm, swollen. So it looks like it is a little bit firm. Okay, Mr. Jones, going to put your blanket back down here a little bit. Okay, so now I'm going to go ahead and expose my patient. Put some gloves on here. Mr. Jones, are you comfortable? Good. Okay. So I'm going to go ahead. I'm going to have my patient roll on their left side, laying on their left side with their right leg over. So I'm going to go ahead and expose him. Perfect. And I'm going to go ahead and get a bath blanket because I don't want him to feel too exposed. I want to make sure I have plenty of privacy, curtains pulled, and him covered up as much as possible. Okay, perfect. Okay, and I'm going to go ahead and lay my disposable chuck down as well. Okay, so I'd have him roll up a little bit and tuck this under. Mr. Jones, I'm going to tuck this under you a little bit, okay? Perfect. Okay, so now I'm ready to go ahead and give the enema. So I want to make sure that my my tubing is clamped, before inserting it, because I don't want there to be a mess or pressure rushed into him. And so I'm going to go ahead and take my cap off and dispose of that. Okay, so I'm going to make sure that my bag is not up on the stand whenever I go ahead and undo my clamp, because that would rush too fast. So my tip is pre-lubricated, but if it was not, I'd make sure it was lubricated 2 inches. And then I'm going to go ahead and insert the enema 3 to 4 inches, and I'm going to make sure I lift up the buttock to be able to get good positioning. Mr. Jones, I'm going to go ahead and insert the enema now, okay? So if I met any resistance, I would ask Mr. Jones to take a deep breath. I'd also maybe unclamp it a little bit to get a little bit of water in there, or saline in there, to soften it. And if I still met resistance, I would take it out and inform the doctor. So I'm going to go ahead and insert it 3 to 4 inches towards the umbilicus. Okay, now I'm going to go ahead and unclamp it because I've got it down here ready to go. And I'm going to slowly lift it. Mr. Jones, you might feel a little bit of pressure. So if at any time Mr. Jones was hurting or had a lot of pressure in the stomach, I would stop and give him about 30 seconds and try again. I would clamp it or take it out before trying again. And I want to lift it no more than 12 to 18 inches. Mr. Jones, are you still doing okay? Good. Okay, Mr. Jones. I'm going to go ahead and reclamp it. Okay, Mr. Jones, I'm going to pull the enema out now, okay? Enema tube out. Perfect. Okay, so now I'm going to wrap all of this up and dispose of it. Go ahead and get rid of these. Make sure he's repositioned well. I want to make sure to ask my patient to hold it for 5 to 15 minutes if possible. Before I take this off, I'm going to put on a new pair of gloves, I think. If he can hold it for 5 to 15 minutes. If not, I'd make sure his call light is close so that I can get here for when he needs to go. Things are ornery. Okay, I'm going to wipe his bottom to make sure it's good and dry with a towel, and I would dispose of this, my dirty linens. Okay, then I'm going to go ahead and take the bath blanket off and cover him back up. Again, as I said, I'm going to make sure he's laying down if possible for 5 to 15 minutes, and lower his bed back down. And then I make sure he had his call light so he can call me whenever he needs to go. And I have my bedpan ready, and so I'm going to record the enema, what solution I used, and how the patient tolerated it, if there was any pressure or pain. I would also help with the bowel movement whenever the time came, and then I would document what that bowel movement looked like, the consistency, the color, and the amount, and then I would also reassess the abdomen.